Hello, Mr. Pineda. Thank you so much for joining me to my video presentation today for my maternal project. Today we are going to be talking about high-risk pregnancy and how this impact the care of a prenatal woman.
Okay, I appreciate it. Thank you.
Hi, Mr. Pineda. It's my understanding that you do have a couple questions for me. I'm glad to assist you answering those, as I know that your wife is recently pregnant and she's a high risk.
Yes, we put some questions together. Obviously, she's not able to make it, but yeah. So the initial question we have is, what is a high risk pregnancy?
Yes, Mr. Pineda, a high-risk pregnancy is a pregnancy with a more complications for the mom, the baby, or for both than a usual pregnancy. It does not mean that there is not a potential outcome for a healthy pregnancy or a potential outcome for a healthy delivery within this pregnancy.
Okay. Well, that's encouraging to hear that it could be completely normal and safe and everybody healthy.
Of
Definitely.
course.
Um, Second question is, what causes a high risk pregnancy?
So some of the causes for a high-risk pregnancy, we do have a maternal age. Any woman 17 years old or 35 years old older, it's a high risk pregnancy. And it's also a high risk to develop other conditions as a preeclampsia and gestational diabetes. We do also have lifestyle choices, meaning if your wife has an alcohol consumption, obesity, underweight, if she smoke, or if she use any drugs also. All those are indicators for a high risk pregnancy. We also have on the other side the pre-existing um, health conditions. For example, if she has hypertension, if she has diabetes, heart problems, or any autoimmune disorder, will likely develop complications during the pregnancy. She has also history of multiple pregnancy, meaning she carried twins. This is another big factor for her to develop complications in a pregnancy.
I see, understand. So if we've had previous pregnancies and they were normal, this one could that doesn't stand for anything as far as the abnormal for the high risk.
Well, because she is now over 35 years old,
Correct.
she is basically already classified as a high risk
That's
pregnancy.
perfect. Okay. Um, what type? So, what type of management will we be doing?
For the prenatal care, what's going to happen now? She's going to have more frequent prenatal visits to the doctor.
Okay.
She will probably be referred to what we call the maternal fetal medicine, which is a specialist
Sure.
for high risk pregnancy, and they will most likely run a series of tests
Okay.
to monitor for the well being of the baby and also for your wife.
Okay. I got it. If you don't mind me asking, what are the tests?
Part of the test, they normally start with an ultrasound. This is an ultrasound to monitor the develop and also the growth of the baby and the well-being. They will also suggest, highly recommend for her to do what they call the nuchal ultrasound, or it's called an NT. So this is a test where they're going to check for the fluid in the back of the neck of the baby. And normally they check for this for chromosomal abnormalities and like Down syndrome. There is also another type of test they call alpha protein test. This one is to check for neural defects. If your baby has any spina bifida problems, it will be detected there. There is also another test like amniocentesis to check for the lung maturity of the baby, cardiocentesis, among other tests.
Wow. Okay. Pretty intense.
Pretty intense.
So, no. Okay. No, I can definitely relay this message back to my wife and discuss what we have in front of us.
Absolutely. In conclusion, Mr. Pineda, although her pregnancy is classified as a high risk pregnancy, and it is a little bit concerning, it does not mean that she is not going to have a healthy pregnancy. It might be a little bit more complications, complications that she will be able to manage and overcome with the proper care. She needs to keep in contact also with her healthcare uh, provider to manage and to also plan the proper care for the pregnancy and to have, as I say, a healthy baby and a healthy mama.
Great,
Any other
appreciate it.
questions?
No, ma'am, I think it was pretty
Thank you.
informative.
Thank you all. Hope you enjoyed my video presentation.